For today's webinar, we have a special guest who will moderate the Q&A session later on. I'd like to introduce Tony Tesserolo, Director of the Center for Forensic Sciences in Toronto, Ontario, and let him say a few words to start things off. Tony, thanks for joining us today.
Thanks very much, Tom. Hello and welcome to everyone to this webinar on wellness and operations. This is the third of a three-part webinar series that has been organized for you by the Members Resource Committee of the American Society of Crime Lab Directors. The series explores the impact of COVID on operational forensic labs. Two webinars were held earlier this month that covered two additional relevant topics: remote testimony and remote work. On behalf of ASCLD, many thanks to Tom, Tyler, and everyone at FTCOA and RTI for their assistance and support in making this webinar happen today. The COVID-19 pandemic has had an immeasurable impact on the way people work, how they play, how they learn, and how they socialize and interact. And for many people who are employed in roles that provide an essential service, like those who deliver forensic science services, the additional burden of performing their duties throughout the pandemic has brought on an additional level of stress and challenge. We're very fortunate to have three excellent presenters with us today to help us explore wellness during the time of COVID and to discuss what we can do to help our colleagues, our teams, and ourselves. Following the three presentations, we'll use the remaining time in the hour for a question and answer session. As Tom said, please use the chat window to ask your questions, and I'll do my best to distribute them to the presenters. Bios for all the presenters are on the website. Please feel free to refer to those. But just briefly, our three presenters are Amy Jean-Guinat, who is CEO and Principal Consultant at MindGen. And a special shout out to Amy. I visited her website, which is mindgenllc.com. I thought I'd have a look at it to make sure that I knew a little bit about her work and how to pronounce her name. And there's this wonderful pronunciation guide where she says, say it fast in French. So as soon as I read that, I knew exactly how to pronounce her name. Dr. Andrew Levin is a board certified in adult psychiatry with added qualifications in forensic psychiatry. He's also an associate clinical professor of psychiatry at Columbia University. And Jamila Dikwashi is with the Office of the Chief Medical Examiner in New York City. So our first presenter is Amy Jean-Guinat. Over to you, Amy.
Hi, I'm Amy Jean-Guinat, and today I'll be presenting shortly on crime lab culture momentum and specifically looking at the issue of wellness. Have you ever caught yourself thinking or saying, and maybe just inside personally or advice you've given someone else, in order to do this job well, you need to have a special compartment in the brain. You need to suck things up, don't bring work home with you, stay disassociated if possible. You'd be crazy to think otherwise. This is just how it is. It's never going to change. Keep her moving. The problem with this way of thinking, which is very much what our crime lab culture is caught up in, is that these special compartments that we're using tend to leak. And what that leak can show up as is brain fog, chest pain, tension in the neck and shoulders, addiction, lack of trust, depression, numbness, digestion woes, anxiety, pain, inflammation, a poor immune system, reproductive problems, aloofness, insomnia, disease, the inability to set effective boundaries, communication issues with colleagues, friends, or family, not wanting to go to work, and making more errors. And I know this sounds like a list of side effects you might hear on a TV commercial for the latest drug advertisement. But these are just a few issues that materialize when we don't effectively process workplace and life challenges. I had a major leaky compartment. In retrospect, I know now I had signs of chronic stress, vicarious trauma, and burnout. Now, stress occurs anytime our needs are not met. What chronic stress is repetitive distress, where our physiology and emotions can't recover between periods and we end up with negative effects. We're more moved away from equanimity and it can become harder to bounce back. Vicarious trauma is a result from incidental or sustained exposure to other people's trauma. This can make one feel more on edge about their work or even avoid certain situations or activities due to an experience encountered in casework. And burnout is persistent frustrations with the work environment. This can look like changes in attitude towards work, loss of engagement, increased sarcasm, and feeling unsupported. Now, these are all really independent from one another, but they can all occur at the same time, and they don't need to happen in any order. Something like one triggering event could cause some of these symptoms to show up, or many events over time. The American Society of Crime Laboratory Directors Stress and Trauma Working Group put together a resource for you to learn more about these definitions, how to detect them in employees, and how to start thinking about managing the symptoms. So I would direct you to this document for a good place to get started. And it's Management, Detection, and Mitigation of Stress, Vicarious Trauma, and Burnout in Forensic Practitioners. To be clear, I did not know these definitions when I was experiencing symptoms. I just knew I didn't feel good, and it was holistic. I didn't feel good physically, mentally, or spiritually. The special compartment in my brain was leaking majorly, and the momentum had existed for so long. I didn't know how to stop it. It is this shared momentum, you could say culture, that we all live and work under. Sometimes we have a pulse of how healthy our organizations are, and we often use the word morale. Morale is good or morale is bad. Maybe as a director or manager, you feel responsible for the morale of your organization. I know I did. It's important to have a baseline for how does your staff deal with the day-to-day stressors of the job, right? Because there are certain commonalities. There are things of the job that we're not going to change. High volumes, working in an adversarial system, being in a system that has zero tolerance for errors. These are outside of our control to change. And not all stress is bad. So we need some to get us moving in the morning, to make a deadline, to perform or compete. So the goal here is not no stress, but moderation. And you can take a pulse of your organization to get a baseline through surveys, through mind mapping, or you might already know because your employees are vocal and they're telling you how they're feeling. It's important to just start where you're at and not compare yourself to others or other organizations. You could start by just keeping things simple and trying to classify your baseline as red, yellow, or green. Most people know what those colors mean. So on a normal day where you just have the common stressors from work, how are you dealing with things? If your organization is more red, then shifting momentum is essential. And learning how to process challenges that exist as part of the job is where you need to start. If your organization is mostly green or yellow, then leadership can shift towards recognizing what are the triggering moments when the staff may be experiencing other issues. Right, so when we might move beyond everyday stress into chronic stress, you want to consider these and moments. So we have the stuff we always deal with, and there's a new sheriff in town. So I'm using that figuratively, but that could be literal for you, or a new police chief. Changes in upper management. These are things that can trigger people, especially when policies and procedures are changing and affecting the workplace. And deployments. This could look like sending staff overseas, going to the border, going to a COVID unit, or dealing with mass and natural disasters. And changes to volume or type of work. So such as what's been seen with unsubmitted sexual assault kits, increases in opioid cases, or shifting to a new department. And really violent cases or those that might hit close to home. So consider cases that could mimic a person's situation, such as domestic violence, cases with children, or cases with pets. And life changes. So diagnoses, death, divorce, marriage, kids, these can all be and moments. And 2020/2021, right, a pandemic, social unrest, political turmoil, racial tensions. These are and moments for all of us, and maybe even more so for your employees of color. There have been a lot of life-altering options to consider over the past year. The prefrontal cortex in the brain, the area responsible for complex planning, working memory, and analytical thinking, is being swamped, right? There's all these ambiguous signals in our environment that the brain can't figure out what's going on. Because the brain is always trying to find familiar patterns, right? Our implicit knowledge typically helps us figure out how to handle situations. But 2020 looked a lot different. And how many times did you hear the word unprecedented used? Right, new situations challenge the mind. And this is a huge reason that people want to grasp on returning things back to normal, because the brain can handle familiar a lot better. Even going out in public has a heightened sense of threats now, right? Maskers versus anti-maskers, physical distancing and group size requirements. All of this combined impairs our decision-making abilities and can leave a person feeling fragile, frazzled, on edge, and unfocused. It is these and moments that we really shouldn't put in a special compartment in the brain. The suck it up momentum needs to slow way down. We need to pause it, even if just a moment, so that we can figure out how to pivot. Could you be a deviant and instead catch yourself thinking or saying, in order to do this job well, I need to take care of myself daily? It might seem so simple, but it's so revolutionary at the same time. Right? Say it out loud with me. In order to do this job well, I need to take care of myself daily. And notice how that feels for you. I need to rest when I'm tired, take time away, play outside in nature, connect with friends and family, feed myself wholesome foods, meditate, focus on gratitude, create, move my body, and consciously breathe. Possible side effects of good self-care habits are a sense of balance, feeling connected to others, sleeping through the night, having more energy, joy, being able to have your intuition guide you, learning when to say no and when to ask for help, mental clarity, calm, resilience, self-love, compassion, healthier in mind, body, and spirit, patience, awareness, and a better mood. It is this pivot in my own life which has me living a hyphen career as part forensic scientist and part mind body scientist, because we can train in the areas that increase our awareness, self-regulate our bodies, learn to work with emotions instead of pushing them into a compartment, and develop compassion for self and others. In the American Academy of Forensic Science keynote from 2021 on diversity and inclusion, Dr. Montgomery shared a slide on how to move towards cultural transformation and what stops it. But environment and social economic factors can prohibit cultures from even considering an idea. So will your organization move past this when it comes to the health and wellness of employees? Or are you stuck here, not even thinking that you need to have the conversation? Education. Can we hold well-being education on the same pillar as technical education? We have all of these needs wrapped up in what a forensic examiner needs to do annually. And how about including things around wellness? Richie explained that most initiatives get stuck in a continuous loop of buy-in and engagement. This often looks like getting together a task group, doing some research, and writing a paper, and then not taking further action. And starting all over in a couple of years when someone else reminds us, hey, this is still a problem. On the wellness issue, my current pulse is we're still trying to enter, or we are stuck in this roundabout. Breaking out into implementation and further, it's going to need creative thinking skills, a new vision, and funding. And it's hard to think through this issue when you're experiencing the symptoms firsthand. You need to be the shift. If you want to change your organization, you have to take a really good look at yourself. How aligned are you with wellness values? How much time in your calendar each week do you set aside time for yourself? Do you view stress as good or bad? Reflect on these questions. The answers can start to ripple out to others. You can then discover if wellness is or should be a pillar of responsibility in the organization. Then, how can team and individual goals align with this effort? It is here that we can begin to shift the momentum. Thank you.
Okay, well, thank you very much. Thank you to ASCLD and RTI for inviting me to present the results of our gap assessment of stress, vicarious trauma, and resiliency for forensic science professionals. This is a study that was done as a collaboration between NIJ and ASCLD. Heidi Putney and Daniel Crimmins were contractors who did a lot of the data analysis and brought together the study. And of course, Jonathan McGrath is at NIJ. None of the opinions expressed in this presentation are related to the opinions of the Department of Justice or of Columbia University. We don't talk about any commercial products. And as I said, the sponsors of this program were the Stress and Trauma Working Group at ASCLD, as well as NIJ, who funded the project. Many of you are, I'm sure, quite familiar now with the terms vicarious trauma and burnout. Vicarious trauma, also sometimes called secondary trauma, is characterized by really the same kinds of symptoms that we see in post-traumatic stress disorder: intrusive thoughts about traumatic material, avoidance of reminders of that material, kind of withdrawal, some negative symptoms and perceptions about the self, disturbed sleep, jumpiness, edginess. Vicarious trauma, on the other hand, really is more this concept of a change in worldview. Was developed by McCann and Perlman, who were really looking at therapists, as opposed to secondary trauma developed by Figley, which really involved more emergency workers and first responders. So vicarious trauma involves this change in how we feel about ourselves, how we think about the world. Is the world such a safe place now that I know about trauma? Is there really a spiritual being? And then the third concept that people are probably familiar with is burnout. It's actually an older concept. It refers to the response to really heavy workloads, and the responses are fatigue, cynicism, decreased effectiveness, absenteeism, attrition. And we know that those are, of course, challenges for any workplace. Research that's been done in these areas, a lot of research on health professionals, both first responders and longer-term providers, other responders such as EMS or firefighters, law enforcement. I did some work on attorneys, and there also is some work on judges. There's a limited amount of research on forensic professionals. We don't have time to review it today, but in general, about 15 to 20% of forensic professionals in a large study by Holt of about 900 professionals experienced secondary trauma and vicarious trauma kinds of symptoms in response to their work, in response both to the workloads and the demands, as well as the nature of the materials that they were interacting with. What are some of the risks for secondary trauma and burnout? Well, an obvious risk would be the frequency and intensity of exposure to challenging traumatic material, details of crime scenes or details of assaults or pictures, for example. Interaction with families and victims. And of course, this is an important element for crime scene investigators as well as first responders. Graphic material, intentional cruelty, we know that that's a lot worse than being exposed to a hurricane, for example. What kinds of victims were involved? We know that material related to children is very challenging for professionals. We also know that identification with the victim can be quite challenging. What's the context like? What kind of training and support is available in your setting to grapple with these issues? What kind of supports do you have outside of work? What's your workload like? And individual factors in terms of personal history of trauma or psychological challenges. We know that people who struggle with these may have fewer coping skills and fewer reserves. We also know that women are more vulnerable than men, and this seems to cut across the whole trauma and anxiety area. So we developed a study to dig into these areas, and here were the questions that we wanted to try to answer. First, are field-based scientists more likely to report secondary trauma than lab-based scientists or their managers? Second, how does secondary trauma vary across forensic specialties, DNA, photo, latent prints, for example? Third, what percentage of employees reported that they believe their facility has procedures or policies in place to promote employee health and wellness? Does this vary between the three groups? And third, are burnout, secondary trauma, and job satisfaction, how are they related to lab-based scientists' perceptions of their facility? And actually, this would be all the scientists' perception, lab-based, field-based managers. So we did this study, as I said, in collaboration with ASCLD. We distributed online surveys to forensic laboratories and medical examiner offices. We started, of course, by asking people basic demographics, job description, time spent, as well as elements such as testimony, exposure, things like this. And then we used two major instruments, the first being the Vicarious Trauma Organizational Readiness Guide. This was developed in a collaboration between DOJ and actually Northeastern University. And second, we used something called the ProQual, the Professional Quality of Life. This is an instrument that's been around for a while in various forms, developed by Beth Stam, looks at elements of secondary trauma, burnout, and job satisfaction. So looking at the Vicarious Trauma Organizational Readiness Guide, which will be available to you, we're going to include a link to that, but this is an open source instrument. It's available online, and it asks employees to record their perceptions of what their organization is doing in terms of vicarious trauma. How sensitive is their organization in the area of leadership, in the area of management and supervision, in the areas of employee empowerment and work environment, in training and development, and lastly, in terms of providing health and wellness activities. So for example, here are some of the questions. My facility provides training and education to all staff on work-related vicarious trauma and its impact on work performance, strategies on how to address work-related stress and vicarious trauma. Meetings with my manager or supervisor provide a forum for addressing exposure to trauma. The whole issue of is it okay to talk about trauma and exposure to trauma with your supervisor? And lastly, my organization provides wellness activities. So these are kind of sample questions in these various areas. The Professional Quality of Life Questionnaire rates the following issues, as I mentioned: secondary trauma, burnout, and job satisfaction. Here are some sample questions. For example, I feel as though I am experiencing the trauma of a case I have worked on. That would be, of course, an example of secondary trauma. I feel depressed because of the traumatic experiences of the cases I have worked on. Or in the burnout area, I feel overwhelmed because my caseload seems endless. In terms of job satisfaction, I am pleased with how I am able to keep up with new techniques and protocols that allow me to work on cases. I believe I can make a difference through my work. So these, of course, would be questions focused on job satisfaction. So we distributed our survey to about 1,800 people. We got a 28% response, almost 520 responders, mostly females, mostly women, which of course reflects who works in labs. About half had master's degrees. The majority of the people that we surveyed were lab-based. About 10% were field-based, and that was a big enough number to make some significant comparisons. And then the rest were managers and supervisors. These are, of course, people who were at the bench maybe earlier in their careers and are now in a management role. They may still be at the bench, but they identified management as their principal activity. And then we looked at, contact with victims families. These were smaller numbers, victim services, but these did constitute an element of the group that we studied. So what did we find? Well, first, in terms of this question about field-based scientists compared to lab-based or managers, and we found that field-based scientists, folks who went out to crime scenes or went out to death scenes, reported significantly more secondary trauma than lab-based scientists, and intuitively you would expect that. Still, it's important to realize that both groups scored kind of in the middle of the questionnaire, but field-based were higher, managers were somewhere intermediate. We didn't find any statistical difference between secondary trauma in lab-based scientists and managers, but there was a trend for the lab-based scientists to be higher, and again, that would make sense given the fact that they are more directly involved with the material. In terms of forensic specialties, we tried to understand were there any differences between specialties, and we found in general that all the disciplines reported that they were experiencing secondary trauma on a kind of sometimes basis. We did find some trends, though. Interestingly, we found higher scores on secondary trauma for crime scene investigators and also photographic evidence professionals. And again, that makes sense. These are folks who probably have the highest exposure to traumatic material as part of their normal work pattern. How about perceptions of whether their facilities promoted health and wellness? Well, interestingly, we found a trend that suggested that lab-based scientists believed that their organizations were adequately addressing wellness more than field-based scientists, might reflect how much time they are in the lab and the ability to assess these things. We also found a significant difference between lab-based scientists and management. And it showed again that lab-based scientists had a higher belief that their facility was addressing wellness compared to managers. But the differences, again, were relatively small in these groups. We did have another, though, very interesting finding, which is, in general, do you believe, did the scientists believe that the facilities were promoting wellness? And as many as 50% in some facilities said that they thought never or rarely. And interestingly, of course, we went back to the facilities and talked to them about this. And some of them said, yes, we're just developing programs. But others said, we do have programs, but we think that our employees don't know about them, aren't utilizing them, maybe don't have the time. So this is a significant issue, both promoting these kinds of programs and making sure that there's enough internal marketing and opportunity for people to actually use them. And there weren't any differences between managers and the other groups. And then this finding, which we think really is the most powerful finding of the study. So this table shows in the vertical column on the left, the different elements of the Vicarious Trauma Organizational Readiness Guide inventory, management, mission, supervision, et cetera. The bottom one, by the way, is SH, is health and wellness. And we found that secondary trauma was negatively related to people's perceptions of what their organization was doing. So the more that someone believed their organization was working in these areas, and in fact might have been, the lower their secondary trauma and the lower their burnout. And these are pretty significant correlations. So you would imagine on the flip side of that, people were more satisfied with their work if they believed that their organization was addressing these issues. So what are some of the conclusions that we developed? Well, first, Field-based scientists reported more secondary trauma than lab-based personnel. We expected that, and this suggests a real need to be keen on supporting, of course, all the scientists, but particularly field-based professionals. Second, that secondary trauma seem to be relatively equal across forensic specialties, but the CSI, the crime scene investigator group, field-based group, and the photographic evidence group were higher, so we need to pay attention to them maybe in future studies. 25 to 50% of professionals felt their facility was doing very little to promote wellness, and this is an issue of both increasing the services and increasing the internal marketing, and perceived and presumably actual services themselves correlated with secondary trauma and burnout, as well as satisfaction. And this really was a clear indication that these services are meaningful, they have an impact on how employees feel, and that facilities really need to pay attention to providing these kinds of services and increasing general awareness in their organizations. We'll be taking questions a little bit later. This is my contact information and Jonathan McGrath at National Institute of Justice. Thank you for your time, and I look forward to your questions.
Good afternoon. We'll be discussing wellness and resiliency at the New York City Office of Chief Medical Examiner. During this presentation, I will perform an overview of our agency, which may help you understand some of our issues, review wellness at the OCME, research, which has helped us assess where we are, and also our lessons learned and future plans. OCME's jurisdiction is the city of New York, which has a population of approximately 8.6 million people spread over 322 square miles. Our main facilities are the Manhattan Administrative Headquarters, 3 borough forensic pathology centers, and 2 family service centers. We also operate laboratories, the Department of Forensic Biology, or DNA Laboratory, Forensic Toxicology, Molecular Genetics, and Histology. We have approximately 750 employees spread across the 5 borough locations and a variety of departments. In 2017, our agency leadership decided that wellness and resiliency needed to become a priority. Working in a forensic setting meant that our employees, especially those who worked in forensic operations and the laboratories, experienced stress, vicarious trauma, and burnout at higher rates than the average person. Being able to mitigate or detect these stresses would not only improve employee well-being, but also help the agency retain them. Mitigation and prevention is not easy because the forensic setting would always have work-related stresses and traumatic experiences. There's no one-size-fits-all approach, but it was important that an attempt was made to observe and assess behaviors and provide resources to address them. The agency collaborated with experts in the field to determine agency needs and best approach. They are Dr. Joanna O'Flaherty, Dr. Kevin Gilmartin, Amy Jangonat, and Dr. Andrew Levin. We conducted surveys and research and also established a wellness committee to ensure long-term success of the new wellness program. It brought a diverse voices to the table, and we were able to leverage those perspectives to make sure our program meets the needs of our employees. Currently, funding for wellness is not specifically allocated within our agency budget. Our initial collaborations and programming were funded by reallocating funds within our forensic operations, forensic biology, and health and safety budgets. We also leveraged existing city resources. Thankfully, our current mayor and his administration have made an unprecedented and citywide commitment to close critical gaps in mental health care, not only for city residents, but also for city employees. WorkWell NYC is a bureau within the city's Office of Labor Relations. Through their Partners program, WorkWell collaborates with City of New York agencies to create sustainable workplace wellness models. Annually, we apply for support, which includes training, technical assistance, program development, and funding. We can receive up to $10,000 every fiscal year. The Mayor's Office of Thrive NYC promotes mental health for all New Yorkers. We have been a major part of one of their initiatives, the Vicarious Trauma Working Group. This group helped agencies develop a set of strategies to help support employees exposed to stress, anxiety, and vicarious trauma. At the beginning of the pandemic, they also provided a toolkit, which included actionable steps, guidance for clear messaging, and best practices for agency leadership. The goal was to reduce the stigma of mental health challenges, build awareness of available mental health resources, and to encourage our employees who needed mental health support to connect to care. We also worked with the Department of Health and Mental Hygiene to coordinate mental health first aid training and other courses like grief and loss and the art of effective communication, which is especially helpful for those employees who are interacting with members of the public who have experienced loss or are victims of crime. The Employee Assistance Program provides stress management and mental health education, referrals and resources to assist city employees and their families. We have worked directly with them to develop OCME-specific group sessions and programming. They have also come on site to provide group grief counseling sessions when employees have experienced loss at work or were exposed to extremely traumatic cases. Now, the Work Well program categorizes our wellness approach using the following main categories: Be well, address mental well-being; move more, physical activity; eat well for nutrition; and take care for prevention. The items listed below each category are programs we have offered to employees. So these are therapy dogs under mental health, on-site virtual meditation, mental health first aid training, mental health courses and webinars, premium app subscriptions to Calm and Headspace. For physical activity, we have offered fitness classes like yoga, soca fitness, and dance. We purchased walking desks and distributed them across the agency. We have participated in STEP challenges, and we also offer fitness discounts. For nutrition, we offer nutritional workshops, cooking classes and demonstrations, salad socials, discounted access to WW, which is formerly known as Weight Watchers, and a 5-a-day your weight challenge, which is really just encouraging employees to eat healthy. Under prevention, we offer free flu shots, employee smoking cessation assistance programs, diabetes prevention programs, hypertension prevention and management program as well. These are pictures from some of the events we offered and the items that we provided. So we have our therapy dogs. We had a salad social, but we also provided different ways of drinking water, yoga, and that's also a picture of our walking desks. We also distribute newsletters and communication. So these are just general resource flyers for event announcements. We send out on a monthly basis newsletters to communicate our events within and outside of the agency and share wellness tips. Flyers, which include discount codes and free access to mental health resources, are also provided. We also linked employees to city bikes. Last March, we were poised to become the epicenter of COVID-19 deaths and infections. This was the largest mass fatality event in New York City's recent history. It was 10 times what we experienced after 9/11. Over 30,000 people passed away in the city. To address this, we surged our forensic physicians, scientists, and technicians into full pandemic response positions to meet the demands of this public health crisis. Most administrative staff worked remotely. This pandemic has had a significant effect on our employees. Many were and still are working extended schedules. A large number were performing auxiliary functions and were exposed to additional stresses we could not anticipate. For example, lab technicians were handling the dead in our portable morgues or talking directly to distraught families in a command center. Backlogs were created, and these needed to be addressed once the labs were functional. These all intensified the stresses and vicarious traumas staff experienced. In the first weeks of the pandemic, our agency head, Dr. Sampson, made the quick and difficult decision to suspend all on-site programming to prevent COVID-19 exposure. As a result, we quickly shifted to virtual programming. This helped us promote on and off-site engagement, which incorporated mental health support and promoted healthy lifestyles to those with chronic health conditions. Some of the things we offered were Zoom therapy, EAP small groups, online resilience courses, guided meditation, virtual fitness classes, cooking classes, and also a 10-week hypertension program. Many restaurants were closed and staff couldn't leave. They were exhausted and access to food was limited. So in the early days of the pandemic, we attempted to address this issue by coordinating the delivery of catered meals donated by local restaurants, programs, and individuals. We also reallocated funding from canceled programming to purchase wellness packages. The employees appreciated these. The packages included 2 cloth face coverings, alcohol wipes, and a hand sanitizer. My Wellness Committee co-chair and a colleague who worked at the Clark County Coroner Medical Examiner in Las Vegas are both interested in performing research on mental health. Clark County handled notifications, autopsies, and investigations after 58 people were killed at an outdoor music event in October 2017. In October 2019, the Wellness Committee distributed a mental health survey. An additional check-in survey was distributed in July 2020. Results from the pre-COVID survey, in addition to results from data connected from Clark County, was recently published in the Journal of Forensic Sciences in March 2021. The wellness survey results illustrated that there's a severe lack of training regarding mental health and wellness throughout the forensic sciences in both academia and workplace. As expected, COVID-19 exacerbated burnout and stress. The culture where we prioritize mental health is slowly changing. Another follow-up survey will be distributed to continue to collect data. While the emotional importance of mental health and emotional health has received attention, the pandemic highlighted how critical our initiatives are to employee well-being. Our wellness program must address mental health in the same manner we handle nutrition, fitness, and chronic conditions such as diabetes and heart disease. We want to create a culture that encourages open and honest communication around mental health and provide training to managers so they can spot issues and respond appropriately. They should also encourage staff to take the time to participate in activities being offered. This includes education and training to build resilience so employees can rebound after experiencing stress or trauma, and that is one of our main goals. We must have a supportive environment, not only to identify stress and trauma, but also have effective mitigation plans. Thank you for affording us this opportunity to present and to discuss our program.
Thank you very much, Amy, Andrew, and Jamila for 3 wonderful presentations. We do have some time left, about 15 minutes for a Q&A session. And before we jump right into that, I'm going to ask you to participate in an audience poll question. And if you scroll down on your screen, you'll see the question a little bit lower. It's a very straightforward question, maybe not a simple one to answer, but a very straightforward question. Is stress good or bad? And these are the kinds of questions forensic scientists hate, of course, because there is no middle ground here. It's very binary. Is it good or is it bad? And so we hate these, of course. If we're on the stand and we get a question like this, we want the opportunity to try to explain our answer one way or the other. But the question is purposeful, and I'm glad that so many of you are answering it. And you can see that the data is coming up. It looks like it's about 2/3 to 1/3, alternating back and forth. So most of you think that stress is bad. If you had to pick one side of this, it falls a little bit on the bad side. And we'll let that roll around a bit. And Andrew, what are your thoughts about what you're seeing here? And not just perception of whether stress is good or bad. we're flipping. This is like watching the election results. It's flipping back the other way now. So what are your thoughts? Is stress good or bad? And what are your thoughts about how people are answering the question? I'm not sure if you're on mute.
Can you hear me now?
Now I can hear you. Wonderful.
Great. Well, this is a great question because stress is something that organisms face at all times, and organisms have evolved and adapted to deal with stress. And I always like to refer to what we think of as the inverted U curve. So if you take a U and turn it upside down, and the y-axis is performance and the x-axis is the level of stress. So a certain amount of stress increases your performance, alertness, functioning, and to some extent well-being. But once you get over a certain level, then your performance and your wellness really start to decrease. And I think that's what we're talking about, is how to help professionals manage these high levels of stress, from whether it's mass casualty events or the challenging material that they encounter at a crime scene, or through materials that they're examining in the lab. So that's what we're looking at, this balance issue. And I'm not surprised the graph is 50-50 here.
Yeah. It seems to have evened out, hasn't it? But just on that point of balancing, Amy, you talked about in your presentation these. You talked about the baselines, the red, yellow, green baselines. One of our attendees asked a question about that. How do you define the baseline?
Sure. So let's first look at the extremes. And one way to define it, I mentioned, and also Dr. Levin further talked about this ProQual survey. That is a method you could use to start to form a baseline. But green would be that the day-to-day stressors of the job are handled in a way that you would consider your staff bounces back pretty quickly from them. Overall, you'd categorize your morale as being good. There's good conversations and working relationships around the topics of how the day-to-day stressors affect us. Red, on the other hand, would be your organization does not handle the day-to-day stressors very well. Overall, you'd probably categorize morale as bad. It takes staff longer to bounce back from what they may be perceiving as threats as the day-to-day job challenges. And then yellow would be somewhere in the middle, where there might be some periods of time where the day-to-day stressors are handled okay, but you might have some setbacks, and then you kind of go back and forth. It becomes a good talking point. It could be even good to bring up in small group discussions in your laboratory about where do people think they are, and then do a survey to see if the data supports that.
Yeah, because where you think you are may not be actually where you are.
Yeah, but perception is so key. So like with this survey here, that's really funny. Obviously, it's a tough question because intuitively no stress is both good and bad. But it is our perception of stress, and especially in the moment, that can affect our health. So there was a study done through the University of Wisconsin by Dr. Richard Davidson, where they looked at 8 years of perception of stress and its impact on mortality. And this had more than 25,000 participants were asked to rate their stress level. And then over the past year, do they believe that stress influenced their health? And so the next 8 years, they used public health records and recorded the death of subjects. And what was interesting here is that test subjects that self-reported high levels of stress and they believe that stress impacted their health had a 43% increased death rate.
Wow.
And test subjects that self-reported high levels of stress and did not interpret stress as negative had the fewest deaths in 8 years. So it really did show that our perception of what is going on, if we're dealing with things as challenges or as threats, can negatively impact or positively impact our own health.
Just shifting gears a little bit and over to you, Jamila. One of the questions that we got from the audience was around whether your organization allows these wellness activities to staff to participate in them during work time, because I gather that that's not always the case. And so if the answer to that is yes, what's your message to organizations out there right now who maybe don't do that? And how can we convince those organizations and the leaders of those organizations to support those with work time?
So yes, both of these are done on duty, and we also struggle with getting employees to participate in these events. Many are hesitant because they're scared that they may be punished for somehow participating, but we're trying to change that with working with our management to ensure there's a cultural shift where we basically let people know that, employee morale being increased because they are participating in these events will only ultimately lead to increased job performance. So it's mostly everyone has to participate in this across the agency, from the employees right up to upper level management. It has to be a cultural shift. If people are comfortable participating, then work becomes better. So,
right. So that leads to another question, perhaps for you, Andrew. There's this concept, and we're really bad at this at Forensic Science, or really good, depending how you look at it, of managing and monitoring all of our work. We have metrics for everything. And that seems to be the focus, is to manage the work, and we'll look after our people along the way, as opposed to maybe a different philosophy of looking after the people first and having the work take care of itself. Is there any sort of support for that scientifically, that that's the right thing to do, or what are your thoughts on that?
I'm not sure about the level of support, but I can tell you in my experience in agencies, and particularly in agencies that have divisions that focus on trauma, that those divisions really improve their functioning and morale and overall productivity and satisfaction by integrating into their format, support, time to discuss cases in ways that were let them look at the personal impacts of them and the stress. So I think that certainly as a clinician, we know that taking care of people really redounds to the benefit of all.
Mm-hmm. Thank you. And so just on the topic of the balancing of responsibilities, Amy, you talked about your role, and in fact, in your role, one of the questions we have from the audience is the fact that you are a part-time forensic scientist and part-time wellness expert. How do you combine those two fields? How do you balance those things? And then perhaps more broadly, how do you separate work from home when you work from home, which is something that a lot of people are doing these days?
So my simple answer to both is boundaries. And that, I think, is one of the most difficult things to have when we are feeling stress, is we don't know how to create those for ourselves. So boundaries is how I both manage being a forensic consultant and a wellness consultant, and also how I try to divide up my time working from home. And it's true, there's been studies now to show, because so much of us now end our workday and we walk out, the office door, the bedroom door, and we don't have that commute, which used to be helpful to distress, wind down, allow yourself. And so even taking a few moments to maybe do a pattern interrupt, this could be some movement, this could be dancing it out, this could be breathing, something that you do that you make part of your routine to end your day before you then greet your family or your evening or whatever that looks like. Integrating those little things can sometimes start to help. We want those quick fixes. And just as Jamila mentioned, like this culture shift, these are 5, 10, 20-year plans on how to actually do this. This isn't something that in a year from now, your lab's necessarily going to look completely different, but we can start to make these shifts with small changes.
Wow. And Jamila, with respect to the plan that you've helped put in place at OCME, have you received any feedback from staff on how it's working? And then secondly, what advice would you give to those people out there in the audience who want to implement something like this in their own labs? What are the key pieces of advice that you would share with them to make it happen?
So we have seen it work because employees are participating and also expressing gratitude for having the programs offered. I think the best thing to do, because there's no one size fits all, like I said in the presentation, is basically to try different things. Different employees, different people deal with things different ways. So they may be more interested in some things where they be more active, or some people need more mental health support. So it's basically trying different things and just hoping that people will participate. I think that's it.
And do you think, has one of the questions that we got from the audience is around whether participation increased or decreased over 2020? Did you find, I mean, trauma, vicarious trauma and trauma existed before the pandemic, but has that led to increased participation, do you think?
It has led to increased participation because it's not only a focus at the agency, but also something that I think they're doing across the country. So it's becoming more a new normal, and people are more comfortable actually not feeling, that they had that negative perception of what mental health support is like, but it's becoming more normal So people are letting down their guards and actually trying to participate and actually engage or actually get help. So we also are pushing managers to help employees participate. So because they know they're getting support from the people they report to, it's a little bit easier for us.
Thank you. Just on that topic of management, Andrew, you know, there's a lot of books out there. Simon Sinek has a book out there that says leaders eat last, and promotes the fact that, you know, sort of managers are at the back of the line and need to serve everyone else first. When it comes to wellness, do you think that managers short themselves on the support that they need to respond to vicarious trauma and to keep themselves well?
I do. I think one of the pitfalls of management is the notion that I'm a perfect manager if I devote all of my energy to taking care of the people I manage, because that's my job. And of course, any extreme approach like that leads to neglect, exactly what Amy's talking about. So I think that managers need to be sensitive. The other thing is that management can be an isolated experience, and you need other managers to support you and help you look at the specific stressors of being a manager, which are both similar and different from the people you're managing.
Indeed. So maybe we have time for maybe one more question, and I'll turn it over to you, Amy, to talk a bit about remote work. Now, remote work was one of those things that we discussed in a previous webinar, and something that staff have been very interested, certainly in our lab, taking advantage of. But forensic science is the kind of work that not everyone can work from home all the time. And so there's sometimes a sense of inequity, perhaps, that I think adds to some extent to the stress that's created in the workplace. Is that a real thing? And is there anything that we can do to deal with it?
I mean, I think when we're thinking about wellness, this falls in line with all the other positive initiatives: equity, diversity, inclusion. These are all sort of part of the cultural changes that we do need to look at, because our wellness shouldn't just be reserved for certain types of people. But it is true that because of your job, there might not be certain things that you can partake in or participate in. And so how can you make that fair? And that may be balanced by offering something else to people who, you know, have to go to crime scenes and aren't in the lab or can't be at home, or have to go in the lab and process the samples, and you're not a data analyst who can sit at home and just look at the statistics coming back or the data coming back. So it's maybe not everything can be offered to everybody, but where can you fill in places that people working offsite can do instead of people in the lab, or vice versa, so that there is at least some balance that is occurring.
Great. Thank you. Well, that takes us to the end of the hour, but which flew by very quickly. It's a really important topic, and we've been very lucky to have all three of you on this panel today. I want to extend my sincere thanks and appreciation to all of you, Amy, Andrew, Jamila, for your presentations and for sharing your expertise with us today. I know, Amy and Andrew, you have some additional resources available to the audience, and there are back on the main page of the webinar for those individuals that would like to refer to them. Check out Amy's website as well. And with that, I'll say thank you to all of you, and thank you to the audience for listening, and pass it back to Tom for some final words. Thanks, everyone.
Thank you.
We would also like to take this time to thank our audience for joining us today. These webinars would not be possible without your attendance and support. Before you leave today's webinar, we would like to ask you to participate in a short survey. You can locate that link back on the webinar's main page. Simply click the word survey, and that will bring up our quick customer satisfaction survey for today's event. Your feedback about our webinars is vital information that we use to provide you with the best webinar experience and adjust the content and the way we disseminate the information to our audience. One more thing to draw your attention to: you should see we are putting links into the chat to all our social media pages, such as Facebook, LinkedIn, and Twitter, as well as a link to our website at forensiccoe.org and a link directly to our podcast episodes. Make sure you are following us on social media and subscribe to our newsletter to stay up to date with everything that FTCOE is doing in the forensic community. Thank you again for attending, and we hope everyone has a great rest of your day.